I'll start recording. So that's the lecture on the content of cancer and neoplasm. So concepts of care of patients with neoplasm or cancer. So sharing the screen. Does anyone have any experience with like patients with cancer, taking care of patient with any type of cancer in a hospital or nursing home or any other health institution or agency, or experience with just patients with cancer? Anything that you know about cancer?
Yeah, they're in a lot of pain.
Go ahead.
They're in a lot of pain. Patients that have cancer.
Uh-huh. Yeah.
Yeah.
So it requires a lot of pain management in terms of, when it comes to nursing care of patients with cancer, given that they will be on severe pain, regardless of what type of, of cancer. And I mean, pain experience varies. It depends on the type of cancer as well. What else? Let's focus on the pathophysiology of cancer, because in adult health too, we cover the concepts of care of patients with cancer. So we kind of focus on the nursing care of patients with different types of cancer. And any other experiences with patients with any type of cancer?
They feel very isolated, like nobody, unless they're with other cancer.
Right. Yeah. Social isolation is one of the also, you know, kind of serious problems with patients with cancer, especially if they take um, the chemotherapy and radiation therapy, and they have like physical changes in their appearance, and the alopecia and the falling of the hair, and all these changes in the patient's the head, no hair, right? And it's just very frustrating to see all these changes in the patient's appearance, and the patient feel like they are not uh, you know uh, uh, like connected to others, and they have like social isolation and other psychological problems. What about the pathophysiology, like specific things about the pathophysiology, like development of cancer,
Well, it's
how
four stages.
cancer develops, for example? Go ahead.
There are 4 stages depending on where it's at in your body.
Right. So we have cancer. Um, it depends on the type of cancer. Is that it go through at least? Let's focus on the 3 main stages: from the initiation, promotion, and progression. So before we go into the stages, let's just briefly talk about um, the cancer. It's a group of diseases, and it's characterized by uncontrolled and unregulated growth of cells. So the cells are no longer in control or under control, and they are going just autonomous cell division without no control. Because what governs the cells from becoming autonomous and going into like uncontrolled cell division, unregulated cell division, we have specific enzymes and we have specific rules that govern that. And we'll talk briefly, about the cell division, how it's controlled and regulated for healthy cells. But for the cancer cells, they become autonomous and they are going through an uncontrolled and unregulated growth and cell division. So it's somehow, I mean, the cancer is kind of connected to the aging. It doesn't mean that all people as they get older they will have cancer, but that what we have found is that the age is one of the biggest factors that is associated with cancer development. For just one simple reason is that over time and every day we live in we encounter these cancer moments in terms of that our cells will find they are present on a daily basis, but our immune system is able to fight them and to correct these because cancer develops it results from the mutations, genetic hit. We call it genetic hit or genetic mutation. So over time, our body, our immune system, healthy immune system, competent, is going to encounter these on a daily basis, and they will correct and fix them. But the longer you live, the more hits you get, and that's the risk of getting that's why you find the highest percentage of cancer among all age groups, among older adults. So although cancer is often considered a disease of aging, with the majority of cases diagnosed in those over age 55 years, it occurs in people of all ages. But it's just a factor. It doesn't mean all patients, as get older, they will get the cancer, but it's one of these kind of biggest factors that the older adults, they have the highest percentage of cancer of all types, is just because of that principle or that concept, is that as we live longer, we will be exposed to the large number of genetic hits. So there's an estimated of about 1.5, 1.5 million people in the U.S. that are diagnosed annually with invasive carcinoma. We excluding the basal and squamous cell skin cancers. So of course, the cancer occurs in people of all ages, but the most cases are diagnosed with in those over age of 55. Now, the incidences of many cancers have declined largely as a result of the preventive efforts. We try our best to prevent the cancer from occurring. And we'll talk about all these factors and how the cancer as a disease develop over the years. It doesn't come just in a day or two or a month. It develops over years, over a long period of time. So the incidence of other types of cancers, such as kidney, thyroid, pancreas, liver, uterus, skin melanoma, multiple myeloma, and non-Hodgkin's disease, these are or has been increasing. And for the most part, the incidences of most of the cancer types have declined as a result of preventive efforts. So, which means it's working. The cancer in general, for all different types, they are higher in men than women. And it's second most common cause of death in the United States. And that comes after the heart disease. So cardiac or heart disease first, and then cancer is second. And it's the leading cause of death in people 40 to 79 years of age. So from this slide, we will say that the cancer result when there is a damage that will cause the abnormal cell growth and development, which means that the cell will go through a abnormal proliferation, and which would result in also a abnormal differentiation, which means undifferentiated cell. And we'll talk about what do we mean by proliferation. Means cell division, basically, but differentiation, we'll define it in a minute. What do we mean by differentiation? So the cell, when it's cancerous, it's first of all, we said it's autonomous, mean it's would go through cell division with no control, or it's no longer like abide or like compliant with with the rules of cell division. So it will, because of the mutated gene or mutation that has resulted in the this cancer. So the growth of the cell, which means, or the cell division, proliferation is no longer under control, and also would result in a undifferentiated cell, because each cell is supposed to have a function. These cancer cells, they have no roles, have no function. In other words, that let's say like we have cells in the GI tract supposed to be like responsible for the absorption, right? And let's say like in the small intestine. When it's cancerous, now it's undifferentiated. It no longer has that specific function. So we call it undifferentiated. Undifferentiated means has no function. So the cells, when it comes cancerous, doesn't like become cancerous all of a sudden. Again, we said it goes through the different levels or phases, and it may go to like hypertrophy, hyperplasia, becomes and then anaplasia, and then neoplasia, which is when anytime you hear neoplastic or neoplasia means cancer. Neoplasia or neoplastic cell, cancerous cell. There are too many reasons. Just highlight certain factors or reasons for increased incidence of cancer of different types in affluent societies. And you can, include some of these factors like, high fat diet, sedentary lifestyle, stress or stressors. All of these are in addition to other factors, but these are the most important factors. That's why the incidence of cancer is more on high frequencies and prevalence in affluent societies. So the regulation of cell division, again, we said that, the genetic makeup and the genes, they are responsible and they control the speed of the cell division. So there is full control through different mechanisms. There is one of the rules called the contact inhibition. Contact inhibition, which means that cells do not multiply and divide on top of each other. That's prohibited. But in cancer cells, they'll be able to do that. So they will violate that contact inhibition rule, and they will be able to multiply and divide on and build on the top of each other, and that's why we'll get the what is called, so from fast and high speed of cell division, proliferation would result in what is called a tumor and other factors. But this is just to give you an example of one of the factors how cancer cells become cancerous, or the cells become cancerous. So this is one of the rules that's going to be violated, called contact inhibition. Cells do not build or divide on top of each other. So the three phases or steps in which the cancer disease develop or go through: initiation, promotion, and progression. So the initiation, which refers to the damage or mutation of the DNA, which will result as the cell becomes exposed to any of the initiating substances or events, chemicals, environmental, genetic, immunologic or viral, spontaneous in origin sometimes, which would result in the mutation. So that's the initiation. Now the promotion, which involves the mutated cell's exposure to the promoters or the factors that would enhance its growth. And these promoters, you can list here, like nicotine, like alcohol, estrogen as a hormone, nitrates, like the food additives, and one of the labels we used to see, no MSG, monosodium glutamate. I believe that's some type of of a nitrate. And in addition to the other chemicals, the label was like on the some of the bags and the by some companies, making sure that these the product, it doesn't include or have any of these chemical agents or what is called the cancer promoters. The latent period may range from like 1 up to 40 years. That's why cancer sometimes takes up to 40 years to develop. So the more you are exposed to the same promoter, same factor, same chemical, same promoter, then or hormone or any other substance that is cancerous or carcinogenic, then the high likely the person will develop cancer. So the latent period, it takes about 1 up to 40 years. So for a disease to be clinically evident, tumor must reach a critical mass that can be detected. So let's, for example, a tumor that is 1 centimeter, which is about like 0.4 inches, which is the size that you can or you are able to detect by palpation. As you palpate, you can detect it, you can feel it. This tumor that is 1 centimeter, or which is about 0.4 inches, it contains about 1 billion cancer cells. Imagine the size of this small tumor, which is 1 centimeter, contains about 1 billion cancer cells. A 0.5 centimeter tumor, which is the smallest that can be detected by current diagnostic measures like the MRIs, for example, magnetic resonance imaging, MRI, it can detect as small as 0.5 centimeters tumor. It can be clinically detected by the MRI. So under promotion, you can say that the promotion characterized by reversible proliferation. So we still there is a high chance, or the the large like the big chance and opportunity for the person to change the the lifestyle, the exposure to certain chemicals and so forth, that this phase and this step is reversible. So the promotion, it's characterized by reversible proliferation of altered cells. So the activities of promotion are reversible, like obesity, smoking, alcohol use, dietary fat intake, or high fat like diet. So an important, because sometimes the promotion initiation, we get kind of confused between these two steps or two phases. An important distinction between initiation and promotion is that the activity of the promoters is reversible. And that's the key concept in cancer prevention. It is reversible in promotion. That once you are no longer exposed to these promoters, you can reverse the changes which has been already made or done or took place in the body. And approximately like 1/3 of cancer-related deaths in the US are related to the tobacco use. Unhealthy diet, physical inactivity, and obesity. So the highest prevalence, which is about 1/3, I would say 1/3 of the cancer-related deaths in the US are related to these factors: tobacco, unhealthy diet, physical inactivity, which is sedentary lifestyle, and obesity. We have um, some carcinogens, which is the factors or substances that can cause cancer, and we call them complete carcinogen. So some carcinogens are capable of both initiating and promoting. So some carcinogens are able to do both, the initiating and promoting the development of cancer. And these carcinogens are called complete carcinogens. And one of them has been proven to be a complete carcinogen as tobacco. And that's the cigarette smoke is an example of complete carcinogen capable of initiating and promoting cancer. Now, when we get to the progression, which is characterized by the increased growth of the tumor, as well as its invasiveness and metastasis, progression is the final stage in a natural history of cancer. Metastasis is the spread of the cancer to a distant site. Metastasis could also be that the cancer metastasized to a distant site as well as to adjacent site. Cells next to the cancer cells. Cells next to healthy cells next to the cancer cells can be affected as a cells close to the cancer cells. Also, that is metastasis, because we will talk about the 3 different ways or methods of metastasis: to proximal, as well as to distant sites, like adjacent sites, and to distant sites. Like, for example, when we say distant sites, for example, patients are diagnosed with breast cancer and then eventually, develop a liver cancer. So that's a distant organ when it comes to liver, right? That is distant from the breast cancer. So that's a primary cancer is the breast cancer, and then the secondary cancer is the liver cancer, which has resulted from the metastasis of that primary cancer. And certain cancers, they seem to have an affinity for a particular tissue or organ as a site of metastasis. An example of that would be like the colon cancer or colorectal cancer, colon cancer, often spread to the liver. And we can sometimes, scientifically explain how metastasis, occurs and, the method of metastasis based on certain theories. But some some scenarios or cases, it's very difficult to even explain using the scientific method. And or the metastasis is, is kind of very complex concept. And we'll get to also the other concept in cancer, which is the factors that are carcinogenous. And also there are some unexplained areas in that too. For example, for people who are exposed or constant exposure to hair dyes, they are at risk for or to develop the cancer of the bladder. So bladder cancer can result from the constant exposure to the hair dyes. So association-wise, or how is that hair dyes are connected to the cancer of the bladder? That is another question. It's scientifically, it's kind of unexplained kind of area. So other cancers are unpredictable in the pattern of the metastasis. It's just unpredictable, like then in the cases of melanoma, for example. So the cancer, the development, there is something really critical about the cancer cells is that they are able to supply themselves with perfusion or blood vessels and create their own blood vessels for perfusion. We call that angiogenesis. Angiogenesis, which will assist the cancer cells to live longer, and they will have their own blood vessels and blood supply. And the advanced cancer can secrete angiogenic factors. One of these major, just let's focus on one of them, which is the VEGF, which is the vascular endothelial growth factor. This is one of the factors that the cancer cells are able to produce, and which is a hormone or enzyme and chemical that is going to, which is a growth factor here, right? So it's going to, this factor will aid and assist in creating blood vessels. It will develop blood vessels from the main blood vessels so that the cancer cells are able to get the blood supply. And based on this concept of the ability of the cancer cells to secrete this growth hormone or growth factor, which will provide them with blood supply, there is a cancer medication or drug called Avastin. The Avastin was the advent, or the manufacturing, the drug, and it was based on this concept, which was approved to treat cancer because it will prevent the angiogenesis. So it's anti-angiogenesis medication. The drug is going to prevent and stop the VEGF enzyme or growth hormone, the growth factor, from being secreted, so that the cancer cells will not have enough blood supply. And that was just to give you an example of how medications are developed when they, work on a medication that has to be based on the pathophysiology and the mechanism of action on and the disease process. Another concept in cancer cells, how they become immortal, means that the immortality is another feature of these cells. They are able to live, longer. They do not have an end, like a date, to die, or what is called apoptosis. The apoptosis, that's which was, we defined apoptosis as a programmed cell death, right? So as this telomere, so the telomere, the last section or segment of the last segment of the DNA is called telomere, and we have a telomerase enzyme, and the telomerase enzyme responsible for the length of the telomere. The cancer cells, how they are different from the healthy cells is that they are able to produce this telomerase enzyme, and that will maintain the telomere long enough, and will not become short with each cell division. Because we said that the apoptosis, that the telomere would get shorter with each cell division until the last cell division will completely not present, and that will result in the death of the cell. But in cancer cells, the cancer cells can produce these enzymes, which is the telomerase enzyme, which will make the cancer cell immortal, and it will never die. So, and that's another feature of the cancer cells, which make cancerous. It's autonomous in terms of cell division, undifferentiated. It's unregulated cell division and uncontrolled cell division. These are just examples. Give you an example of the changes in the normal cells and how it become cancerous, and the progression of the dysplasia to neoplasia. We said the cells go through like hyperplasia, dysplasia, anaplasia, and then neoplasm. And these are the 3 stages or phases of the cancer development. Another example of different types of cancer. The first one on the left here, it's small hepatic adenoma, benign neoplasm. The one in the middle, which is the neoplasm, that is benign. It can be benign or malignant. And this one is the benign lipoma, which is like a sac filled with lipids and fat. And this is taken from the small intestine. That's a lipoma and the serosal surface of the small intestine. And this one can be benign neoplasm. Sometimes people develop these lipomas under the skin. It's like a bulging or protruding, raised spot on the skin, and it's sometimes small, large. Depends on the size of the lipoma, but it's a lipid sac-filled lipids. It's like a bag of serosal tissue that is filled with lipid and fat, and that's lipoma, and that's also benign. Most likely, doesn't go resolve by itself. It's surgical intervention would remove it, and that's benign tumor. And the last one on the right side here, on the slide, that's the next step toward neoplasia. And this is it says here, here there is normal cervical squamous epithelium at the left, but dysplastic squamous epithelium at the right. So the same slide, or with the same picture, you find 2 different types of cells. On the right side, dysplastic squamous epithelium. And when you see dysplastic, means it's distorted, or disordered, which means it's no longer under control, cell division or growth of the epithelium. It's going like cell division, proliferation with no control, disorderly growth of epithelium. Other examples here, but this one showing metastasis to the liver, the left side, or the left one. The middle one, it's malignant neoplasm, and that's of the lung. And the last one on the right, hepatocellular, so that's the carcinoma affecting the liver cells of the liver. So there are 2 major distinctions in the process of cancer development, and I mentioned briefly that these 2 dysfunctions. The first one is the defect cell proliferation, which is the cell division or cell growth, and the second is the defective cell differentiation. defective cell proliferation, which is the cell division or the cell growth, and the second is the defective cell proliferation. And the defective cell proliferation or the growth, no longer under control, autonomous cell division with no any compliance with any rules of cell division. The stem cells, they are undifferentiated cells and ultimately differentiate and become mature functioning cells of only that tissue. And normally most tissue or most tissues, they contain a population of undifferentiated cells known as stem cells. Now, the defect in the cell differentiation is that each cell has its a specific function, either absorption, digestion, secretion, right? So each cell has its own like specific function, and you can refer to the fundamentals of the pathophysiology in chapter 2 in my PowerPoint slides. The first PowerPoint slides I presented, it's some of the slides there provide a review about or on the functions of different cells, right, in our body. So all cells are controlled by an intracellular mechanism that determines proliferation, which means proliferation means cell division. So that's the cancer cells. They are characterized by loss of contact inhibition. I mentioned that earlier about by the cancer cells are able to, or they are not in compliance with these rules, and they will, build, divide and grow on the top of each other. So they grow on top of one another and on top or even between normal cells. This feature or this description is completely prohibited by healthy normal cells. And that's the reason why the cancer results in tumors. And we mentioned that, a 1 centimeter of tumor contains about 1 billion cells. So these cancer cells are going to divide indiscriminately and continuously, like what is called a pyramid effect. We call that a pyramid effect. So the defect in cell differentiation, which means that these cancer cells no longer are going to function as or same as what is supposedly or previously determined by the system, that they have a specific function, right? So, but they are no longer going to function that way. So they are undifferentiated. They are not going to assume that role or do the function. So that's why we have a defect in cellular differentiation. Now, two different types of genes that can detect, can be affected by mutations. Two different types of genes that can be affected by mutation. The first one called proto-oncogenes. Right here. So it should be proto-oncogenes. These genes, they regulate normal cell processes such as promoting growth of the cells. And the other type of genes called tumor suppressor genes. And they suppress the growth of the cells. So the tumor suppressor genes, they suppress the growth of the tumors. We also call them, the tumor suppressor genes, we call them anti-oncogenes, because they work opposite to the oncogenes. And they function to regulate cell division. So the proto-oncogenes, so back to the proto-oncogenes, the genetic locks that keep cells functioning normally. This is what we mean by the proto-oncogenes. This is it's like a genetic lock that will keep cells functioning normally. Mutations that will alter and change these expression or the expression of these proto-oncogenes, if there is any mutation that is going to alter the expression of these proto-oncogenes, it can activate them to function as oncogenes. And the oncogenes, they are not good, right? Because the oncogenes are going to result in cancer. So when this lock is unlocked, as many as this may occur through exposure to, let's say, like carcinogens, if you are exposed to more exposure to the carcinogens, this lock is going to be unlocked. And will result in genetic alteration and mutations that will occur. So when the proto-oncogenes are mutated, they can begin to function as oncogenes. And when we see oncogenes, they are tumor-inducing genes. So the proto-oncogenes, they are good or bad?
Bad.
Bad.
No, the proto-oncogenes.
Good. They're good.
They're fine, and because they are genetic locks that keep cells functioning normally. But when there is a mutation that is going to alter their expression, it can activate them to function as oncogenes. So proto-oncogenes are our genetic locks, like gatekeepers, right? But when they are mutated, or mutations make them become oncogenes, then that's a problem. And again, the exposure, the longer, the prolonged exposure to the carcinogens or oncogenic viruses, or that's going to result in genetic alteration, and mutations occur and will make these oncogenes, so that the oncogenes are not good because they are tumor-inducing genes. Because the oncogenes, they can change a normal cell to malignant one.
Wait, so Professor,
Yeah,
the oncogenes aren't in addition to the proto-oncogenes. The proto-oncogenes are like turned like a zombie, like turned into the opposite of what they're
they
supposed
will. Yeah, proto-oncogenes, they are genetic locks that keep the cells functioning normally. But when this lock is unlocked, and which will occur usually, through the exposure to the carcinogens or oncogenic viruses or any other carcinogen, then the genetic alterations and mutations will occur, and then that will result in become oncogenes. So oncogenes are the tumor-inducing genes. So let's go to another concept in cancer development. These are some of the examples of the the point mutations. There are some mutations are called chromosome translocation or chromosome amplification, but there are different types of mutations that would result in and create the oncogenes. So I'm not going, we're not including or discussing, these specific mutations, but the mutations that can create the oncogenes are like, we call them, some of them are called point mutations, like the carcinoma, the oncogenes causing the pancreas and colorectal cancer or colon cancer. These are point mutations. Others is called or result in what is called the chromosome translocation, like some type of leukemias or lymphoma. And another type of mutation that will create the oncogenes is called, is referred to the chromosome amplification. Like breast cancer is one of them. Neuroblastoma, another example of that. But these are different mutations that can create the oncogenes. Any questions so far? So before we get to the role of the immune system in the cancer development, it's just to highlight certain definitions of that the normal cell can progress through. So these are like the sequence from healthy to cancerous. So healthy cell become or go through hyperplasia, dysplasia, and then to neoplasia, and neoplastic means cancer. So a neoplastic cell, cancerous cell, is without normal form and function. So it doesn't have a normal, appearance and the features and the characteristics of the normal cell, and also doesn't have that specific function, which means it's undifferentiated. Neoplastic cells are autonomous, so that they do not respond to normal cell control mechanisms, like what is called the apoptoses. So that's why they are immortal cells. Neoplastic cells are also anaplastic. Why do we call them anaplastic? Because they are characterized by a marked increase in nuclear size with continuing evidence of ongoing proliferation, which means they are going to increase in size and shape will be different too. Different shape and different size. That's why it's become anaplastic. So it's non-conformity, or doesn't conform to the rules of that the cell division would result in the same exact size and shape, right, of the parent cell. This one is going to be very different, size and shape. That's why it's anaplastic. And then the last thing is final is that the neoplastic cells are undifferentiated. And I explained undifferentiated, what it means, right, previously. So undifferentiated means that they have lost the ability to perform or function, to perform their usual function. Undifferentiated means they have lost the ability to perform their usual function. So there's a So yeah, I'm sorry. I have to go back to that, the role of the immune system. This is very important about the specific features or things that the cancer cells would do to protect themselves and evade themselves and escape from the immune system. Because remember that these cancer cells are supposed to be recognized by the immune system as foreign body and being taken care of, right? But the cancer cells are able to do some type of modification to the cell surface to protect themselves from the immune system. So the T cells, the T lymphocytes won't be able to detect them. So it will hide and evade that immune system by what is called the TAA, which is the tumor-associated antigens. The cancer cells are able to build or create their own antibodies that will cover the, which is blocking antibodies in this case, to cover the tumor-associated antigen. So covering that tumor-associated antigen by their own blocking antibodies, that is the evading system. That's the system how the cancer cells are going to hide from the immune system. And that's one of the biggest challenges for the immune system to find them and to fight them. So they will continue multiplying and growing with no detection because of this principle. So they will sneak through the surveillance system, in other words. So we have a case study. Believe we have to continue, and then I will go to the case study either next week, or we'll see. We can also, post answers if need be, if we can get to that next week. So I'll just skip the case study and excuse me. Gene environmental interaction and risk factors. I have listed too many of these factors from our book and from other resources like other textbooks, and it's very informative in terms of to for some would be like an eye-opening for for some of you, because that includes a lot of resources in terms of what do we mean by carcinogens, and certain things that we've been ingesting on a daily basis. We have no clue that it is a carcinogen, or until we are informed that we have to stop eating too much of this or that, and then that's carcinogen. And one of the carcinogen or carcinogenic materials that we ingest, it depends if so for example, it's this material is present in all diet beverages. If you hold any diet Coke or diet Pepsi on that that beverage, you'll find that that material is present as a and it's found, and it's kind of detected as carcinogenic material. The Splenda, or the other sugar-free stuff. I'm sorry.
Artificial sweeteners.
Artificial sweeteners. All these. These also include that material. So that's chemicals that are we ingested on a daily basis sometimes, and it's carcinogen. Doesn't mean that all people who will be exposed to the carcinogen are going to develop cancer, but just this is one of the factors we attempt and try our our kind of best attempt is to prevent the number of factors that's going to result in cancer. So if that's one of them, one of these factors, we'll try to to stop the factor and prevent the cancer that way. So because cancer would result from the exposure to due to exposure to different type of factors. So I'm not going through like read off from the slide because I just listed all of these factors here, and it's just to informational and also for for the class, but it's a lot of factors that I'm trying to highlight things here. Yeah, like xenobiotics, one of them. Uh, which is like carcinogenic materials or chemicals, and they are found in the human diet. Enzymes that activate the xenobiotics are called, we have like two phases. The phase one is activation, phase one activation enzymes, and phase two detoxification enzymes. And they are potentially carcinogens. Occupational hazards, some chemicals and our exposure to these like substances and chemicals like dyes, even people who work on rubber or paint or aromatic amines, or um, they are exposed to these factors or carcinogenic factors that will result in lung cancer, for example. Dyes also I mean here, not the hair dyes here, but the hair dyes we said that it's connected to the cancer of the bladder cancer. So the last one here says hair dyes could result in bladder cancer. Pesticides, lung cancer. Ionizing radiation, bone and thyroid, and so forth. So you have like resultant cancer from the exposure to different factors or carcinogens. Another case study, and we move on to the classification of cancer. So classification cancer, either it's so we call it tumor because that's that's the overgrowth of the tissue and resulted in a tumor. Now that could be benign or malignant, and some would not call the benign tumors as a cancer because most likely lipoma, for example, skin lipoma, it can be benign tumor, but it's not cancer because it's not going to result in a metastasis or invading other organs or affecting other tissues. So they are not called cancers, but we call them benign tumors. But they are listed under the classification of cancer as benign versus metastatic, or malignant. Benign versus malignant. Malignant tumors, they are definitely metastasized or metastatic cells. They will result in affecting adjacent or or distant cells by the way of metastasis or by a method of metastasis. So they metastasize. That's the malignant tumors, but not benign tumors. So the benign tumors, we have examples is like lipoma, one of them, glioma, and other types. The so the tumors, they are classified according to either the tissue of origin or the site in which they are located, like an anatomic site, or the behavior of the tumor in terms of that, is that metastatic or not. So the classification, like carcinomas, for example, this is the tumor of the epithelial cells. Sarcomas, mostly affecting the connective tissues. Lymphoma and leukemia, hematopoietic system, which means bone marrow and blood, right? Blood forming cells like RBCs, white blood cells, platelets, lymphoma and leukemia. Lymphoma, which is a cancer, arises from the lymphatic tissue. Leukemia arises from blood-forming cells. And staging or stages of cancer, you find something called CIS, which is cancer in situ. And that's the first step or phase in the classification of, or staging, in terms of staging. So when you say carcinoma in situ, it's a pre-invasive epithelial malignant tumor, which hasn't or have not broken through the basement membrane or invaded the surrounding stroma, which means that it's no longer, it's in situ, it's stagnant there, it's not affecting any adjacent or distant cells, hasn't metastasized at all. It's just there, it's in situ. The examples of tumors, here I have lung cancer. So we have A and B. A, which is a healthy lung, B, which is a lung with carcinoma. The lung cancers, they account of about 13% of all new cancers. And 70% of the people diagnosed with lung cancer, they are older than age of 65. For men, it's about 1 in 13 will develop lung cancer, and for women, well, it's about 1 in 17.
So that means like it started to grow when they are young, right?
Mm-hmm. Yeah.
Sorry, what was it? Men, it's 1 in 13. For women, it's 1 in how many?
Actually, the one in 17, it's related to the prognoses, not in terms of prevalence. It's 1 in 13 will develop for men will develop cancer, and for men it's about 1 in 17. Now, this is another classification, but we have two specific methods of classifications for cancer. This is just for the terminology. When you say melanoma, what's the origin of the word? Adenoma, it's a gland. Chondro, it's a cartilage. Erythro, that's red blood cell. So these are just the original or of the words when we develop, or when we go over the terminology and the different types of cancers. The benign is just it's a differentiation between benign and malignant tumors. The benign tumors, they are well differentiated. Lipoma has the same tissue, looks, they are exactly look the same as the original tissue that they aroused from. Same appearance, same shape, same morphology. They are well differentiated, benign. It doesn't metastasize. It's like within a capsule, it's encapsulated, well-defined capsule. The malignant cells, they are We know that they grow rapidly. The cell division is controlled, autonomous. They are poorly differentiated. Doesn't look like the tissue from which they arouse. And a plastic, and we explained what's anaplasia, which is a loss of differentiation. Shape, morphology, size, right, is different than the original or the parent cell. And they are able to metastasize. That's the most dangerous feature of the malignant cells. They're able to metastasize, and they are going to infiltrate into either adjacent or like proximal, and as well as distant cells. They are able to find their own and develop their own blood vessels. Vascularity, which means angiogenesis, infiltration, infiltrative, and expansive, invade surrounding tissues or distant tissues. Sometimes I will talk about the different methods of metastasis, how these cells metastasize, the malignant cells that are metastasized to close or adjacent and distant cells. So metastasis, there are specific steps for metastasis, but the three different routes of spread, these malignant cells, either they're going to spread through what is called local seeding, which obviously they're going to invade adjacent neighbor cells by the local seeding, or bloodborne or lymphatic spread, either through the blood, metastasis through the blood, or they're going to travel through the lymphatic fluid. So three main methods of metastasis. Now, there are certain or specific concepts or steps of metastasis still scientifically unexplained or fully unexplained, but the cancer cells must gain access to blood and lymphatic fluid or lymphatic vessels. And they have to survive the trip to distant locations and move back into the tissues and initiate a new tumor. Like we said, prostate cancer, and which result in pancreatic cancer or colon cancer. Because each of these steps is required so that the successful metastatic cell is rare compared with a huge number of cancer cells at the primary site. So metastasis usually occurs in the late phases and stages of cancer evolution. So it's the late, the last phases of cancer development will be metastasis. Yeah, this is another picture of showing, which provides also the sequence and the process of metastasis. Some of the common sites of metastasis, for example, the breast cancer usually metastasizes to the axillary lymph nodes, to the lung, liver, bone, and brain. The rectal cancer or the colorectal cancer, CRC, metastasize, for example, mostly to the liver, lung, and peritoneum in the GI. Peritoneum, lung, and liver. The lung cancer metastasize usually to the liver, brain, bone, and also the lung could metastasize to the adrenal glands. The adrenal glands on the top of the kidneys. mostly prostate cancer metastasized to the liver, to the bone. And ovarian cancer, cancer of the ovaries, mostly would metastasize to peritoneum, the liver, and lungs. So the stage, yeah, before we get to the staging, yeah, let's go over the staging. So the clinical staging, we have two different types of staging classification, methods of classification for the cancer cells. The first one called clinical staging, and the other one is the TNM classification. Clinically, you can classify it based on the pathology of the cancer cell or the cancer tissue, and the report from the pathology will give you the the report based on the classification of clinical staging from 0 up to 4. And we have also another classification system, is the TNM, T for tumor size, and we have specific criteria for when the size of the tumor, and then that's T0 or T1 or T2 or a T3. So T3, for example, T3, when the scan and or chest wall involved by invasion. N for if there is an involvement of the lymph nodes. The most, the highest on the classification would be N2, which is fixed nodes involved. Under the M, so you will have like T0, N1, M2, for example, something like that, or T0, N0, M0, for example, T1, N1, M0. So this is one of the how, as you read the report from the pathology, you will you will see this type of classification. So as you read for example, it's M1 or M2, for example, here it says suspected metastasis. So which means that each the pathology or the report from pathology will provide you with the result of the classification, and mostly they use both classification systems. This is just the health promotion and the warning signs of suspected cancer, and we can teach lay people, and we can teach people about these signs that could be we this acronym of caution. Primary prevention is meant to reduce or avoid the exposure to any of the known or what has been determined to be known as carcinogens. And we have specific examples of about the carcinogens, and that should be avoided or to limit the exposure to these carcinogens. The secondary prevention, which is the screening, we can screen when breast cancer, and the mammogram is done for for females who have family history or no family history. So on the age and all of this, you have specific age and specific rules about that, about when should, and frequency of doing the mammogram, for example. Testicular cancer, prostate cancer, breast cancer, colon cancer, lung cancer. We have specific criteria for prevention measures, which is in this case secondary measures. So that's for screening purposes. Diagnostic. There are cancer markers, and I just want to highlight some of these cancer markers known as cancer markers, and one of them is called AFP, and which is alpha fetoprotein. This one will be elevated in patients with liver cancer. So it raises a flag anytime you see an elevation of alpha fetoprotein AFP, because that could indicate that there is a liver cancer. BRCA1, BRCA2, they are connected to breast cancer. The CAA, we have carcinoma embryonic antigen. We have too many numbers of the CAA, and which, anytime you have a CAA elevated, that could also indicate a cancer of specific tissue or system based on the number. You have CAA of different numbers. But this is an example that these are cancer markers that they are at least lab work that can be done, and once we review the lab work and see these results, we have to be cautious and careful as we review these results and how to proceed with the diagnoses. They sometimes also do as a screening for screening colonoscopy. All men over 50 is supposed to go every 10 years for colonoscopy if it's uneventful results or like negative results. But if there is any polyps, they have to go every 5 years. Polyps means it's overgrowth of tissues like lipoma, right, inside the colon. So these polyps, they are not cancerous as we speak, but they can become cancerous in the future. They can become cancerous. They are benign polyps in the colon found during colonoscopy. They are not cancerous at the moment, but over time they can become cancerous. So they have to be removed, and we have to recommend colonoscopy every 5 years for that specific person to make sure that if there is any other polyps can be removed in the future, and if there is any colon changes or colon cancer that's going to be detected during the colonoscopy. Same thing for for a family history with breast cancer. Then the woman over 40 years old supposed to do a mammogram every year. So these are like screening and diagnostic studies done to screen and to prevent the cancer, because it's very easy to treat the cancer before when it's small tumor or small polyp or small tissue it becomes like large or metastasized. And then the last method of diagnosing would be biopsies, and these are going to be done by the pathologist in investigating the piece of tissue of the affected organ or affected tissue, and they will give us a report about it. So another cancer marker is called the PSA, which is prostate specific antigen. See here, even the hormones like PSA is one of them. Anytime you see a PSA elevated, prostate specific antigen, that could be an indication. It depends on the level. Either it's the hyperprostate, like hypertrophy of the prostate, or hyperplasia. I'm sorry, hyperplasia of the prostate, or which is benign prostate hyperplasia, right? So we call it benign, but it could be also the high, like numbers of PSA could indicate the prostate cancer. But this is one of the another example, like AFP and the CEA, as what is called the cancer markers. So the PSA is another one. The epinephrine also, if it's elevated, that could indicate the cancer in the adrenal gland. AFP elevated could indicate a cancer in the liver, as well as the PSA could indicate a cancer in of the prostate. Yeah, one of the major consequences, and you mentioned pain at the beginning, and that's obviously one of the manifestations of cancer, and especially when the large tumor is going to press against and put pressure on the nerves, so that will result in severe pain experience. In addition to that, patients with with cancer, from the disease process and from receiving chemo and radiation, they will have severe anorexia, and they will have something called cachexia. And cachexia, which is a severe weight loss and wasting, like a wasting syndrome. And they lose too much weight to the point that they become like a cachectic, or what is called emaciated, which is like skin and bone. That's cachexia. So treatment wouldn't focus much on treatment in pathophysiology. For questions, I will definitely, and for case studies, I will just post the answers on Blackboard. Any questions? So I'll just stop recording.